Garcia, one of the sports knee surgeons. Today we're going to show a patient, 35 years old. Interesting story, had an ACL done in 2014, never really felt stable. Found out after coming into me for a second opinion that she had retorn her ACL graft, but also had a missed posterolateral corner, which is a pretty uncommon thing. The key here was just to get a really thorough examination of her. So we did a full reconstruction of her posterolateral corner and then ACL reconstruction and a few other things with her meniscus, and you could see she had a good outcome and really returned her to her pre-sort of 2014 state. Thanks.
So back in 2014, I tore my ACL and meniscus the first time, had surgery, and then in 2019, I went off of jump snowboarding again and heard 3 pops, which sounded the same exact as when I did that. Had a hard time walking, a lot of pain, didn't feel really comfortable. I went to one orthopedic I've seen before, didn't really get a good feeling, only got a couple minutes spent. So, and then at this point, it was my second surgery I'm going to, so I'm kind of determined that I don't want to do this again. So I got recommended to Dr. Garcia, and that's when I came into the office, and the experience was really good because he actually took the time to look at other things. This was my second time returning my ACL, so there was a bigger picture. It seemed like that was happening. My first impression is actually he took time. He was very genuine about what my needs were as well too. He took the time to explain how my MRI was, did extra testing. It wasn't just a 5-minute conversation, and really explained the type of injuries that I was occurring and what we were dealing with at that point. So that was really good, as where others experiences I've had where I just felt like I came in with this pain and nobody really took me serious at the time with that.
And your quality of life?
A ton, I will say that. So before this first one happened, the second one happened again, I just was feeling very unstable. I had still a lot of pain. I actually even changed and gave up hobbies that I love to do because I just wasn't feeling confident. I didn't feel confident in my knee. I saw other doctors and PTs asking questions, and they just kind of were like, oh, you just muscle or that, didn't really take how I was feeling serious. So it's been a great impact because the surgery that I had now and realizing what kind of injury I had, I am now able to feel confident in some of these activities I wasn't doing before or wanting to do. Back to hiking on that, whereas I would hike before and it would take me about hours to get down, where it should take me 20 minutes just because of the downhill. I have never done an overnight hiking trip before, and I am doing one in 3 weeks. So that's been a very big relief on that. Snowboarding, we'll see, that's coming up, but I feel more confident. Just everything feels more stable. As before, it just felt like this unwary thing. I wouldn't jump off 2 legs, and now I feel like I am able to confidently jump.